Today we're diving into a topic that's absolutely critical but often happens behind the scenes: emergency preparedness for home care providers. We're going to be using the handbook to assist home care providers in emergency preparedness planning as our main guide for this explainer. So let's get right into it.
It's a question that probably doesn't cross your mind much. When a disaster hits, a hurricane, a massive snowstorm, a power outage, we see the first responders out there, right? But what about the thousands of people who are homebound? People who rely on daily in-home care just to get by? Well, this is where home care providers become this crucial, but often invisible, front line. So here's what we're going to cover. First, we'll talk about why their situation is so unique, this invisible front line. Then we'll get into how they figure out the threats they're facing, how they build their master plan, and how they make those incredibly tough calls on who gets care first. And finally, we'll wrap up with why all this planning is so important for everyone in the community. Okay, let's start with the big challenge here. Think about it. A hospital is one building, but a home care agency, their patients are scattered everywhere, across different towns, different counties, each in their own home. That setup creates a seriously complex problem when a big emergency unfolds. To handle that kind of potential chaos, agencies develop an emergency plan. And let me tell you, according to the handbook, this is way more than just some binder collecting dust on a shelf. It's the official battle plan. It's the guide for protecting patients and staff, for working with emergency officials, and for making sure that essential medical care keeps flowing no matter what. And here's a really key point the handbook makes. This planning isn't a one-and-done kind of deal. It's a cycle. You're always preparing for what might happen, responding when it does, and then recovering and learning from it to make your plan even better for next time. It's a living, breathing document that's designed to get smarter with every single challenge.
So how does that cycle even begin? Well, it all starts with taking a really honest, clear-eyed look at everything that could go wrong. I mean, you can't really plan for a crisis if you haven't even tried to figure out what that crisis might look like, right?
The handbook boils it down to this really simple but incredibly powerful three-step process. Step 1, figure out your risks. Step 2, build a plan to deal with those risks. And step 3, you test that plan, you poke holes in it, and you refine it so you know it's actually going to work when you need it. Let's dig into step 1.
The official name for this is a hazard vulnerability analysis, and this is not just guesswork. It's a really systematic process where an agency looks at everything, from where they're located geographically to the specific medical needs of their patients, to identify and then rank all the potential threats.
Now, this is where it gets really smart. They turn this analysis into actual numbers. For every possible hazard, they rate 3 things. How likely is it to happen? How vulnerable are we to it? And how prepared are we for it right now? Then you just multiply those 3 numbers together to get a risk score. Just look at this example. An electrical failure gets a score of 27. Why so high? Well, because it's highly probable the agency is super vulnerable to it and their current plan is poor. That huge score is like a giant flashing light telling them, hey, you need to focus on this first. So, once an agency knows its biggest threats and has its priorities straight, it's time to get to step 2, building the actual plan. This is where they take all that data and turn it into a concrete playbook. And the good news is they don't have to start from scratch. The handbook gives them a tool called the Comprehensive Emergency Management Plan, or CEMP. You could think of it as a master checklist that gives them a framework to build a really solid response, making sure that absolutely nothing gets missed. And the level of detail here is pretty incredible. We're talking way beyond just having extra first aid kits. As you can see, the checklist gets into everything from keeping the business running to having a list of community partners and even having a plan for evacuating patients' pets. It's a plan for the whole shebang: organizational survival and continuity of care. This quote from the handbook just nails it, doesn't it? A home care agency's plan isn't built in a vacuum. It's a critical piece of the entire community's emergency response system. Whether they're ready or not has this massive ripple effect on hospitals, on emergency services, and on the health of the entire local area. Okay, this brings us to what is maybe the most difficult part of any emergency plan: having to make really tough choices when your staff and resources are stretched to the absolute limit. This is all about how agencies decide who gets care first. So, how do they do it? How do they decide who gets help first when every minute counts? The handbook lays out a system called patient classification. It's basically triage, but here's the brilliant part: it's done before a disaster ever happens. It's a proactive system for sorting every single patient by their level of need ahead of time. And here's how it works. Level 1 patients are the most critical. These are people who might be on life support equipment or need really specialized care. You have to make every possible effort to reach them. Level 2 patients, they're more stable. Their care might be able to be postponed as long as you can check in with them on the phone. And Level 3 patients are stable enough that they can likely miss a visit without harm, especially if they have family or friends nearby who can help out.
So when a crisis hits, this classification system becomes the playbook. When the roads are blocked and the phone lines are jammed, the staff knows exactly who they need to try and call first and which home visits are completely non-negotiable. It brings a sense of order to what would otherwise be a totally chaotic situation.
Okay, so we've looked at the risk assessments, the massive checklists, and the triage systems. Let's just pull back for a second and ask the big question. Why does all of this incredibly detailed planning matter so much?
Well, first and foremost, it's about people. The number one goal is just to protect the lives of both the vulnerable patients who are counting on that care and the amazing staff who are out there providing it.
And second, it's about the mission of healthcare itself, right? The whole reason this plan exists is to make sure there's no break in life-sustaining services. It's a promise that care will be there for the people who need it the most, when they need it the most.
And finally, it's about the bigger picture. When home care agencies are prepared, they actually take a huge burden off of swamped hospitals and 911 call centers. They become this strong pillar that supports the resilience of the entire community's health network. A good plan here makes everybody safer.
Which really leaves us with one last thing to think about. We always see the visible parts of an emergency response, the fire trucks, the ambulances, but this invisible front line of home care workers is every bit as critical. Their level of preparedness really helps define how strong a community's true safety net is. It makes you wonder, doesn't it? How resilient is the one where you live? Thanks for joining us.